bringing together voices in child and youth healthcare. This is FCAHS Presents.
FCAHS would like to thank the following member organizations for their generous support of our knowledge translation activities: the IWK Health Centre, the Children's Health Foundation of London, McMaster Children's Hospital Foundation, the Children's Hospital of Eastern Ontario Research Institute, the Children's Hospital Foundation of Manitoba, the Montreal Children's Hospital Foundation, the Holland Bloorview Children's Rehabilitation Hospital Foundation, the Children's Hospital Foundation of Saskatchewan, and Trillium Health Partners. We would also like to thank the following Keystone and program partners for their ongoing contributions that support all of CAFC's programs and activities. If you have any questions or comments for our panelists, please type them into the question box at any time during the presentation. You can also share your thoughts and questions on Twitter by tagging @CAFCTweets and using the hashtag CAFCPresents. All of our webinars are recorded and can be found on the CAFC Knowledge Exchange Network. Use the CAN to share these recordings with your colleagues or register an account and post comments, links, or other resources that you think will be of interest. And be sure to sign up for the CAFC Presents weekly email newsletter to stay up to date with upcoming webinars and our recorded webinar archive.
All right, hello everyone, and welcome to today's episode of CAFC Presents. I'm Doug Maynard, the Associate Director at CAFC, the Canadian Association of Pediatric Health Centres. And today we're going to talk about what we know about sexually exploited adolescent boys, and we're going to hear about a systematic review that's been done by a few colleagues of ours, and it's my pleasure to welcome back our colleagues who bring us lots of research and their findings from the CIHR team in advancing boys and men's health research. First off, it's our pleasure to welcome back Dr. Christine Wekerle, who's joined us many times in the past to talk about, if you look on the Knowledge Exchange Network and do a quick search, you can see lots of webinars that she's done with us related to their maltreatment and adolescent pathways study, or other topics related to caregiving and resilience, etc. So it's a great pleasure to welcome Dr. Christine Wekerle back to our CAFC Present stage. And Dr. Wekerle is a clinical psychologist and an associate professor in pediatrics, and an associate member of the Offord Centre for Child Studies at McMaster University in Hamilton, Ontario. And her research areas are broadly in the area of parenting and the prevention of family violence. And following Dr. Wekerle's introduction to the presentation, we're going to be hearing from Dr. Elizabeth Saewyc, who is a professor and director of the School of Nursing at University of British Columbia in Vancouver. And she also leads the multidisciplinary Stigma and Resilience Among Vulnerable Youth Center. And her research and public health nursing practice has been focused on how stigma, violence, and trauma influence adolescents' health and coping behaviors, and what protective factors can foster resilience and improve health equity for marginalized young people. So it's my pleasure to hand the virtual podium over to Dr. Christine Wekerle.
Thanks so much, Doug, and hi everyone. Welcome, good morning, and it's a pleasure to be here and talk about issues related to trauma, gender, and health. And the painting you see on the cover page is taking advantage of the fact that most museums have open access for their art archives, and this comes from the Tate UK, and when you type in boyhood or adolescence, certain pictures come up, and this is one. What we might think of a gender stereotype, perhaps, of males, young males being about adventure and danger, going out in the seas and listening to a talk from Sir Walter Raleigh. I do lead the team grant in Boys and Men's Health that focuses on a very under-discussed area, sexual violence among male youth. And with the current hashtag #MeToo discussions, it's quite topical currently to be thinking about gender, sexual violence disclosures, and the way forward in terms of supporting greater physical and mental health. I just orient people to our newsletter that's available at www.in-car.ca on the home page, as well as our Wisdom to Action event, where we are able to bring youth and policy people and researchers together to discuss this issue. I also want to alert people to new resources. The World Health Organization, in their attempt to provide standards in mental health, have an Mental Health Gap Initiative. And in that, they have a standardized assessment protocol. And as you see on your screen, this one is relating to assessing the home environment with the right panel talking about the various forms of child abuse and neglect. Child abuse and neglect are also nested within a lot of other topical areas, such as the adverse childhood experiences, or ACEs, which is very getting a real push in the United States in terms of screening. And the journal I edit, Child Abuse and Neglect, will have a special section on ACEs coming up. But this is the decision tree in terms of how to handle disclosures of maltreatment. And we're really talking about here the issues of toxic stress, and maltreatment tends to cluster together. So while we are talking about sexual victimization, our research shows that there's increased likelihood of physical and emotional abuse, and that there's an increased likelihood of re-victimizations in various forms, whether that's school bullying or adolescent dating violence, for instance. And the impact of having a stress system that's too flipped on, if you will, and is that there are impacts to the body and brain structure, as well as functioning and changes to the immune system. And that is part of the momentum behind ACEs, or the NCD prevention, non-communicable disease prevention, is that the relationship ends up being in that fourth piece on the pyramid is the adoption of health risk behaviors. And the health risk behaviors is quite a significant, robust body of literature saying that these lifestyle choices, such as smoking or drug use, sedentary behavior, have significant impacts across the lifespan in terms of these major issues like depression or COPD, and so forth. The Lancet has a push now on adolescence as a critical window of risk and resilience, because of this idea that, we know many of these health issues or lifestyle issues do have onset in adolescence. So if we can target adolescents, then we are potentially changing the trajectory of health for youth currently, but also when they are adults. And because these adults may become parents, we may be disrupting these ACEs cycle. So we come to our research, what about the boys? And we have our project with our publications on ResearchGate, and there's the link for that, as well as a Resilience in Youth YouTube channel. And there's a reference there for a special issue that appeared in Child Abuse and Neglect in 2017. Another resource is the World Health Organization good practice statements. They're put forward some guidelines to deal with sexual violence, because youth who have experienced sexual violence are less likely to seek medical care, but more likely to use drugs and alcohol, and they tend not to disclose. So you may be seeing them in the emergency room for physical presentations, or injury presentations, but there may be other issues. We do have an CHR IHD CYH video talks currently in competition, and this summarizes our number of our team's research findings in asking the question, what about the boys? So thanks very much. We have some open access TED-Ed lessons there that are available for you to use in your teaching, and we do hope that you utilize, check out our Elephant in the Room video, child sexual abuse prevention video, and that's open access for your use as well. And that's what I'll be saying in terms of introduction to Elizabeth's talk next.
All right, thank you very much, Dr. Wekerle. So now we're going to hand the screen over to Dr. Elizabeth Saewyc to go on with the rest of the presentation. And just my chance to remind everyone, if you do have a question, don't hesitate to type it in as you think of it, so we see it in the list of questions before the end. Don't feel you need to wait until the end to start typing your questions. So so over to you, Elizabeth.
Thank you very much. Hello, everyone, and I'm pleased to follow on after Chris and talk about a massive systematic review that my team at the Stigma and Resilience Among Vulnerable Youth Center at UBC has conducted over the past few years to really capture the state of knowledge about sexual exploitation among child and adolescent boys and young men. So, the stereotypes when it comes to sexual exploitation, whether we're talking about what's covered in the media, whether we're talking about what has been released in government reports in Canada as well as in other countries and even internationally, as well as most of the research about sexual exploitation has focused on girls and young women. In fact, we see that the majority of the work has identified a disproportionate number of girls as being at risk for sexual exploitation or being targeted by trafficking and exploitation. And in addition, most of the services that are provided for sexually exploited youth are, again, focused on girls. Now, when you ask the question, what about sexual exploitation of boys or transgender youth for that matter, most of the time there will be a response of, oh yeah, boys sometimes get exploited too, but they're a much smaller group, and that they're not necessarily the focus of most research because they're either difficult to find, they don't come to services because there just aren't that very many of them. This is one of the things that from our clinical practice and some of the research that's happening in Western Canada has caught our attention because we're not finding that same emphasis, that is, that girls are disproportionately exploited. And so part of what our participation in this team grant focused on sexual violence in boys is really to ask the question, when it comes to sexual exploitation, what do we know about boys and their experiences? So in order to actually contribute to that, we first felt like it was necessary to actually conduct a systematic review of the literature. Now, for those of you who haven't done systematic reviews, they involve some fairly comprehensive steps of searching major scientific indexes of the literature using keywords. In our case, it was things like trading sex, exploitation, prostitution, sex, transactional sex, things like that, along with the keywords of adolescent or youth. Reviewing all of the titles and abstracts that come from this massive search, and excluding the ones that are clearly not relevant. Then pulling out the full text of the articles that were kept from that first review of titles and abstracts, and identifying which ones actually are eligible or inclusive of what you're looking for, extracting any information from them, and summarizing those key findings in reports. The purpose of our review was really to answer globally, what's the state of the research on sexually exploited boys, with a series of sort of sub-questions that we added to that. So what factors predict sexual exploitation of boys, especially if those are different from those that predict exploitation of girls? What are the contexts in which they're being exploited? So where does it take place, and what is the exchange being exchanged for, if you will? What social, physical, and mental health outcomes are linked to exploitation of boys and young men? And what services are available that can address the needs of sexually exploited youth, whether that's helping to provide exiting support or to address the health issues that are identified for these young boys. Now, in doing this systematic review, one of the challenges that we came across right away is the massive differences, the huge variety of definitions of sexual exploitation. In some places, the legal definition is quite broad. In other cases, the research definitions can be quite narrow. We actually had reports that we were finding where people weren't actually talking about sexual exploitation, but they were talking about sex work among people as young as 13 or 14. So in order to clarify where we were going to be looking in terms of the inclusion criteria for the research that we were looking at, we provided the definition that's based on the United Nations Convention on the Rights of the Child. Article 34 in the convention, which has been signed by nearly every country, talks about the right to be safe from violence, and specifically about sexual exploitation. It's a little vague, but it does identify it. And then in a much more detailed section, an optional protocol on the sale of children, child prostitution, and child pornography, there is a greater discussion of both the definition of sexual exploitation as well as recommendations around supports legally, both in law for prosecuting the people who exploit them, as well as the services that should be available to them. The definition is for children and youth or minors under the age of majority, and in this case they mostly were just defining it as children under age 18, who exchange sexual activities for money, for drugs, for food, shelter, or for other consideration, whether that's gifts or services, some form of exchange. And those sexual activities can be quite broad. They can include actual sex acts with penetration, but can also include things like phone sex or video, child pornography, or films, as well as stripping and exotic dancing and things like that. It also includes, for people who may be thinking about sexual exploitation in a little different way, survival sex among homeless young people who are under age 18. This definition of sexual exploitation is also, from our perspective, really important to identify that this is a form of sexual abuse. It is not a crime that adolescents commit, but rather a form of sexual abuse. And this change in sort of our understanding socially and legally and from health perspectives about sexual exploitation or sex work among minors, from being that of a criminal behavior or a delinquent behavior to that of actually being a form of sexual abuse and victimization, has been ongoing over the past nearly 30 years since the Convention on the Rights of the Child was first inaugurated and signed. But it is slow in its shift in terms of different perspectives across countries. Now, our particular systematic review was conducted within 5 of the major indexes related to health and social sciences. So they included, for example, PubMed and CINAHL, the Nursing and Allied Health Literature Index, as well as PsycInfo and ERIC or EBSCO host. So a variety of sort of the key indices that would reach health and social science. We had a team of 6 reviewers, and in order to ensure that we were all screening the abstracts and the titles similarly, we randomly selected the first 200 articles out of our search of articles to screen, and each one of us screened them and decided whether or not they would be included and why, and then we came together to look at our concordance, clarified some of the issues around inclusion and exclusion criteria, and then screened 100 more just to make sure we really were all on the same page, and found that our concordance was actually running over 90%. So with that in mind, we then divvied up all of the articles, and each team member reviewed a series of thousands of articles. When there was a question from either the abstract or the title, we actually flagged those and once again brought the team together to review them as a group. Now, one of the first things we realized, and why our team actually is so large, originally it was going to be 2-3 people, and it became a larger team because we encountered more than 11,800 articles to start from, and kind of went, oh my stars. And partly that's because there's no specific mesh heading or keyword around sexual exploitation in any of the search indices that has been in place since 1990, which, since the UN Convention of the Rights of the Child was first inaugurated in 1989, we felt that articles going back to that time point would be relevant. Our search actually first was conducted in April 2015. We updated it recently as part of writing a manuscript for publication. So we added another 3,000 articles to review that had happened between 2015 and 2017. So let me walk you through sort of our process. We found the articles. We got rid of duplicates because some articles were identified in both PubMed, for example, and in PsycInfo. We also took out books and theses because we were focusing on peer-reviewed published journal articles. In going through the titles and abstracts, we were able to exclude another 6,000 that were clearly not relevant. Articles, for example, that were focused on incest, or they were focused on adults recalling sexual exploitation rather than research with adolescents, where at least half of the sample were below age 18. Where the discussion of sexual abuse was more about sexual assault in the community, and there was no mention of exploitation or transactional or trading sex or what have you. Most of the exclusions at that sort of title abstract stage were actually because of the wrong age range, or because the articles were only about girls and they don't mention boys at all. We also pulled out at the methods, so rather than going straight to full text review, because we still had several thousand articles, we then also did a further screen of just opening articles and quickly looking at the methods section where we could find more information about the demographics of a particular population to make sure that we were capturing, did they actually disaggregate boys? What was the average age of the participants, that sort of thing. So another nearly 2,000 articles were excluded at the methods stage. That left us with 217 articles that we read in full, and in that process we're able to further exclude those that didn't fit our criteria because their definition or description of sexual abuse didn't actually include sexual exploitation in any of its forms or definitions, or because the article included adolescents younger than 18, but they didn't disaggregate, so that there was difficulty in, if you've got a sample that goes from 13 to 59 and they don't disaggregate the younger adolescents, it's impossible to really look at information just about sexually exploited boys. Or they included boys and girls, but they didn't disaggregate the boys. They just sort of combined everybody together. So again, it's difficult to understand specifically what is being described by boys. Ultimately, we ended up with 33 articles. And when we did the sort of update of the last 2 years, we added another 9 articles for 42. Mostly today I'll be talking about the 33 because that's what's in our community report. And we are hoping that our revised paper with the update will be accepted soon. So just a quick example of some of the articles. There was one from a Swedish national sample about adolescents selling sex. There was a study in childhood about working with child prostitutes in Thailand from 2007. A study from Canada that I was a co-author on. That was a school student study in rural Canada in the East Kootenays, looking at students who exchange sex for alcohol and other drugs. Another study of street children in Lahore, Pakistan. As these are all examples of the 33 articles that were provided. Now, the studies we found were conducted all over the world. There were 5 from the United States and 5 from Sweden as the 2 largest groups. We also had 4 articles from South Africa. A couple articles each from Canada and the UK and Brazil, and then single articles from a variety of different places as diverse as Ethiopia or Egypt, Pakistan, China, Thailand, Sri Lanka, and so forth. And oh, I think Denmark was one of them. So these are a variety of different places that research has been looking at the experience of sexually exploited boys. Now, as you can see from this chart, the number of articles about sexually exploited boys has actually increased quite a lot in more recent years compared to previous decades. In fact, the first article that we found was in 1991, and there's one or two articles every year after that, but the biggest increase has been subsequently, and as I said, in just the last 18 months alone, where we were looking at from April 2015 to July 2017, we found an additional 9 articles that were relevant. Now, we had hoped as part of this to be able to actually identify some perspective around the prevalence of boys who are sexually exploited. And what we found is population-based data in Canada and in Sweden, in the US, I think also in Norway, where the rates ranged from 2% to about 5%. And one of the things we found with the population-based surveys is equal or nearly equal rates of boys as girls who are sexually exploited. We also found much higher prevalence or percentages of boys who are reporting sexual exploitation in street-involved samples. So, for example, 43% in Ghana, 41% in Pakistan, 16% in Brazil. And in household surveys, we were finding, and those were primarily conducted in Africa, we're finding sort of rates somewhere between these two. In terms of the context of exploitation, similar to girls, boys are exploited in a variety of different locations, whether on the street in sort of homeless venues, as well as, sadly, a certain proportion who are actually exploited by their family or pimped out, if you will, from their family home. Hotels. Interestingly, in the Sudan, drainage tunnels were a common place for sexual exploitation. The internet is increasingly a venue for exploitation, as well as phone chat lines, and in some countries where cell phones are a more regular resource, boys and young men were often involved in using cell phones as a way of being available for being exploited. Now, the types of things that are exchanged, money was the most common identified, but also alcohol and other drugs, gifts, food, shelter. In Sudan, they talked about in-kind types of exchange where, for example, they would help you rebuild your house in exchange for sex. So the types of exchange or consideration are quite variable, and this is not dissimilar to the experiences of girls. In terms of the characteristics or what predicts exploitation, if you will, among boys who are exploited, there have been some really mixed results around family challenges. So in some studies, families with a divorce or breakup, single-parent families, families with unemployment or orphans were more likely to report being exploited. In other studies, actually, mothers, for example, in one of the studies in Africa, I think it was in Ghana, if you lived in a household with just a mother after breakup, you were less likely to be exploited. Other kinds of stressors in terms of poverty and similar things were sometimes more likely to or more associated with exploitation, sometimes not. It was found in a number of studies that boys from more marginalized communities were at greater risk of being exploited. So the sort of operation of stigma or discrimination further placing them at risk for vulnerability to being exploited. So, for example, in Sweden, they identified both gay and bisexual boys as well as new immigrants and youth who were from immigrant communities. In South Africa, older boys who are living away from their parents, and in Canada, among students who were going to school but reported living alone or being homeless were somewhat more likely to be exploited than those who were not. Most of the studies that looked at risk exposures associated with sexual exploitation identified the increased risk of violence victimization. Some of that was, for example, being promised money and then the purchaser beating them up and leaving them without paying. In other cases, it was threats and violence in order to secure their exploitation or to keep them trapped in the exploitation experiences. Even in the street context that already experience high violence, comparing sexually exploited boys to those who are not exploited, boys who were exploited were at greater risk of experiencing violence. Some studies also noted greater involvement in criminal activity, involvement in gangs and drug trade, and an increased risk of arrest among those who've been sexually exploited. However, it wasn't always clear if that arrest might have had something to do with exploitation rather than other kinds of criminal activity, if people were considering exploitation as a form of criminal activity rather than as being victims of violence. So in some of the reports, especially from the Criminology Journal, it wasn't always clear if sexual exploitation was considered a delinquent behavior as opposed to a victimization. When it came to the perpetuating factors, or what keeps young people exploited and unable to exit their exploitation or avoid further exploitation, very few studies that included boys identified those factors. Most of the ones that did actually identified primarily the survival needs, the ability of the money or other goods that young people experienced or received in exchange for sex as meeting their most urgent basic needs. In the Thai study, sexual exploitation of boys was often identified as multi-generational, so previous parents or other relatives had been exploited as boys, and there was sometimes a certain level of pride in their ability to support their families who were extremely poor. In other studies, there was a discussion of the lack of parent awareness about boys being at risk for sexual exploitation as compared to girls being perceived as being at risk for exploitation, that made boys more vulnerable to being exploited because they were less protected or less monitored than girls were when it came to preventing sexual exploitation. The health issues associated with sexual exploitation are common to the health issues of all kinds of sexual abuse, and several of the studies noted the higher risk for substance use, especially tobacco use, alcohol, and other illicit drug use, including heroin, sniffing glue, injection drugs, other substances. In terms of other health issues, some studies reported limited or no condom use among boys who were sexually exploited. I do want to point out that many of the studies framed it as a choice not to use condoms, but in light of the issue of exploitation as abuse, the question was raised in a couple studies, but not all, about the extent to which boys are able to negotiate condom use as part of that transaction, given the significant power dynamics involved. When it comes to physical health, again, very few studies actually examined physical health outcomes of sexual exploitation, and the most common one noted was sexually transmitted infections and HIV as a sort of a key health outcome, despite the fact that there's also, given the significant descriptions of violence exposure very few studies, I don't think any studies actually described injuries or the risk of overdoses or other things from substance use as part of the physical health outcomes of sexual exploitation. Mental health outcomes were more commonly identified, and some of those results were somewhat equivocal in some of the studies, but generally speaking, most of the studies that looked at mental health outcomes did identify poorer self-rated mental health among boys and young men who were exploited compared to their peers in the study who weren't, higher rates of hopelessness, depression, anxiety, and loneliness, including in the school-based or population-based studies, and greater risk of self-harm and suicidality, including some fairly high rates of self-harm among boys who are exploited compared to their peers who are not. We also, because we're the Stigma and Resilience Among Vulnerable Youth Center and part of the team that's focused not just on sexual violence and gender, but on resilience, looked at social supports and access to services as part of the process. And I have to admit that most of the articles, very, very few, actually examined social support among sexually exploited boys, and mostly in the context of a lack of social support. And they found lower levels of family connectedness and poorer parent and youth relationships among those who were exploited. One study in the US noted that exploited boys who didn't have pimps or procurers who were facilitating that transaction reported somewhat more positive assertions about trading sex. They were more likely to identify it as a choice or valuing the freedom or the independence that the money that they got for exchanging sex provided them in the circumstances that they were in. It should be noted that most of the boys in that particular study were all runaways, and many of them were homeless. And so there is an economic issue there, but the sort of self-exploitation in terms of becoming available for purchasers, but again, I should point out that's still exploitation because the people who are purchasing are exploiting youth. When it came to services, there was only one school study in Sweden that actually considered the help-seeking or service uses among exploited versus non-exploited boys. And exploited boys were more likely to access services for family conflicts and other kinds of problems, questions of sexuality, and that's given that they may or may not have the ability to determine who the purchasers are. Boys, regardless of sexual orientation, may be providing sexual services to males, to females, or to both. And if they identify originally as heterosexual, the sort of standard phrase of gay for pay may create significant questions around their sexual orientation. They often access services for mental health issues and exposure to violence and abuse. Now, one of the things that's really important to keep in mind from this systematic review, that the significant variability in the study designs, in the locations and contexts in so many different parts of the world, and the definitions of sexual exploitation makes most of the comparisons between countries or between studies impossible. And generalization is, we're not yet there either, although there were some key themes that were common across a number of experiences and a number of studies. It's also really important to identify that our focus on sexually exploited minors meant that we excluded a lot of research that included young adults. And I would like to acknowledge that we do recognize that sexual exploitation can occur among young adults as well. The challenges are, it looks like the features may be different when it comes to the exposure to violence, the ability to actually manage survival around employment and things like that. And so we really felt like it was important to keep it limited to those where the majority of young people were under age 18. The other limitation is that we drew on the peer-reviewed literature only, in part because finding gray literature reports, there's no systematic index that allows you to actually locate them. But we do identify that our particular review missed some key gray literature reports from governments, agencies, advocacy groups, and from our own organization, where we have actually created some research that has been primarily reported in community-friendly reports as a priority with our community partners, and as a result, were not findable in our specific systematic review, or at least we knew about them, but they weren't included because they weren't part of that systematic part. The other issue is that all of our studies were English language only, and to the extent that other studies might be published in major languages such as Chinese or Spanish, we missed them. What we know, though, in terms of the knowledge gaps is we really know very little about the health issues of sexually exploited boys. Most of the studies, sexual exploitation wasn't a primary focus of the study. It was an ancillary, maybe it was a sub-analysis of finding sexual exploitation as a key predictor of some other outcome. Often those outcomes were focused on social issues such as housing or criminal offending, and not focused on health. We also know almost nothing about services that are available for boys or the effectiveness of interventions specific to boys, or whether the interventions that are for boys and girls are effective for boys. One of the other caveats is that most of the high-income country studies that were about sexual exploitation took place in schools rather than among homeless or street-involved youth. And that is a significant limitation given the higher proportion of sexually exploited youth that were found among the homeless and street-involved young people. So our recommendations in looking at this systematic review is that a lot more research is needed, and specifically more research needed on pathways to exploitation, the context, what it looks like for boys. Who's doing the exploitation? What are they exchanging sex for? Where are the venues in which they're exchanging sex? How old are they when they're first exchanging sex and being exploited? We need more research on the physical and mental health needs and social service needs and effective services for boys. It's really unclear whether services that are designed for girls actually reach boys and young men, although some of the literature suggests that they do, but for a very small, disproportionate number of boys compared with girls. And we need more evaluations in terms of looking at, for agencies that do provide services for sexually exploited young people, how many boys do they find and serve? And are services designed for girls only or for boys and girls? And if they're designed for girls only, what might need to change to reach more boys? We actually know very little about the specific service needs and what will be effective for working with boys. You can download the report that is the sort of community version of the systematic review, although it does include the references of all 33 articles that were reviewed. And stay tuned for our updated academic paper, which is currently under review, and we're hoping to get positive news about that within the next month or so. And as soon as it is accepted, we will ensure that it is published open access so that people can view it widely. And that's my presentation. Thank you very much. And I believe we've left enough time for questions.
Yes, we certainly have. Thank you very much, Elizabeth, and Dr. Wekerle as well. Please, for the audience, please do type in any questions that you might have for either of our presenters. The report that Elizabeth just mentioned, I did put the link in the chat box, so you can go straight to that and check that out. So again, yes, please do type in your questions. The one question I did have was when one of the unfortunate sort of takeaways from this is that there isn't a lot of answers out there. There aren't a lot of answers out there, just in the sense that there hasn't been much research done, and that's certainly, you know, the call to action for our research community out there is there is more research that needs to be done in this area. But, and you may not have you may not have come across this, but I was curious as to whether there were any associations related to disabilities in boys, like cognitive behavioral disabilities like FASD or ADHD, that are more predominant in boys, and as part of a pathway that might lead to sexual exploitation. Did you come across anything of that nature?
Not specifically in terms of diagnoses, but I will say that in the paper from Western Canada on the East Kootenays looking at exchanging sex for drugs and alcohol, one of the other elements of that was that they had actually done a substance use personality profile, and they did identify that boys who scored high on impulsivity were more likely to report exchanging sex for drugs than boys who did not. And that may be linked to FASD or to ADHD or other kinds of ability issues, but that, you know, was not diagnostic of those specific health conditions. So, but to my knowledge, I don't think any of the other articles we saw do identify that.
All right. So, from your perspective, what could, so as Dr. Wekerle mentioned at the beginning, that, you know, from a health services perspective, from the acute care hospitals, often these children are ending, or these young adults are ending up in emergency rooms, sort of in a crisis situation related to, you know, physical health issues that are as a result of, you know, some of these exploitation type issues. You know, you mentioned that a recommendation to improve services, you know, related to boys, or awareness of emergency room staff, that, you know, that this might be an issue, that this might be something to consider when doing histories and that sort of thing. Do you have any advice to those in the audience from those acute care centers as far as what they could be doing from a services perspective?
Yes, I think that, you know, one of the important things is as you're encountering young people in acute care settings, it's important to have that sort of lens on that doesn't just expect that girls are going to be the ones who might be experiencing sexual violence or sexual exploitation. It is, you know, really appears to be the case that it's so much more stigmatized and so much more hidden in terms of, because it's not in our sort of stereotypes or our discourse, that boys and young men may also be being sexually exploited, and that they may be trading sex for survival in ways that we're not necessarily asking, or we're not thinking about that as a possible experience that is explanation for why they're presenting in a particular acute care setting. So it is important to think about it. I do think it's also important, though, to figure out ways to ask the questions, because the sort of additional stigma that sometimes comes with the expectation that, well, boys just don't do that, makes it both awkward for clinicians who aren't used to asking those kinds of questions of boys, but also sometimes makes it harder for boys to disclose. So being really matter-of-fact and asking things about, so how are you supporting yourself, or how are you getting money? Or, okay, so some things that we know that sometimes happens with young people is they trade sex in order to get food or shelter or money or drugs. Has that ever happened to you, or has that happened to you in the past year? Or is that something that you're currently doing? Is a one way of being able to sort of very non-judgmentally, very sort of matter-of-factly ask about trading sex. It is important, of course, when young people are identified as being sexually exploited, that you need to actually be up on the duty to report laws in your particular community, because they do vary a little bit. and it's really important to be aware that if healthcare providers are required to report to child welfare when a patient discloses sexual exploitation, even if they're disclosing this and a procurer or a pimp is not directly involved in their experience, or a family member is not procuring them for others, then young people, if they know that a duty to report is part of your mandate, they may not disclose as a result, and it may take a while for you to develop trust.
And Dr. Wekerle, please do jump in if you do have anything to add. We did have another question come in, and I'm afraid it may have been sort of affected by an autocorrect issue. Perhaps she's typing on her phone, so a couple of the words I'm not exactly sure if I'm going to ask this correctly. So Christine, if I do get this wrong, please do type in a follow-up for clarification. But she's asking about interest in Canada around enforcing laws enforcing existing laws to reduce exploitation via finding and prosecuting the pimps and clients. So just wondering if that's your thoughts on that as a way, that enforcement of laws as a way to reduce exploitation, whether it's targeting pimps or whether it's targeting the clients with those laws.
Right.
Well, I think that there is definitely a piece there in terms of highlighting the mental health, the sexual health, and the suicide risk implications for these male victims of sexual exploitation and sexual abuse, in terms of really clarifying that it is a potentially a life course trajectory, as we talked about at the beginning, in terms of creating in adolescence these really unhealthy lifestyles for coping with these issues. And as Elizabeth mentioned, when impulsivity is thrown into the mix, then that may be part of a driver of ongoing negative health trajectory. And part of every system, whether it's the judiciary, frontline, and specialty services, is to be able to know that trauma event or those trauma events have occurred, and that the services are available to help youth who are in situations like street involved to be able to use services that are paced to their willingness to use services. And I think there's the law, police, sentencing, all that stuff I think is important, and the issue of what about the boys isn't as strongly understood in those situations.
So I can speak a little bit too about that. I do think that enforcement that focuses on both the procurers and the purchasers is an important aspect of both raising awareness and trying to at least take some of the abusers out of the population in terms of actually trying to make it less lucrative for them to be exploiting others and having somewhat of a cost. I think one of the challenges is that with so much of our sort of focus in society on the exploitation of girls, oftentimes law enforcement really is at a loss in how to respond to or how to even identify sexual exploitation of boys. I recall with some of the research that we've done in BC, presenting results to our task force with the Vancouver Police Department, and having one of the constables come up and say, "Oh my goodness, equal rates of homeless and street-involved boys as girls. 1 in 3 report trading sex. What does that even look like? Where do we even see that? How do we address that if we can't recognize where it's happening?" And because guys don't show up very often on street corners in fishnet stockings and high heels. So it is, trying to raise awareness of where those venues are, the contexts are for law enforcement to help engage, but also to recognize that the purchasers may not be who people think either. Some of our research in British Columbia has recently identified that women actually purchase sex from boys and young men. The majority of young men that we've identified who are sexually exploited report women as the people that they've traded sex with. Not always for money, oftentimes more for material goods, but that's not on anybody's radar. So I think that in order for our law enforcement and judicial system to actually be effective in responding to this, they need the information to understand both where and how to look and find, how to establish that trust with victims, and how to ensure, as part of the recommendations from the optional protocol for the UN Convention of the Rights of the Child, that the law enforcement and judicial system is supportive of the victims and is created in such a way that they can have a trauma-informed approach and prevent further traumatization and further challenges to the victims as they are pursuing the judicial approaches. So that's something that becomes really important, that both we're paying attention to the mental well-being, as Chris said, of the victims throughout the law enforcement and legal proceedings, but also that police and prosecutors and judges are aware of the features of sexual exploitation and how it might look for boys, so that they both take it seriously and respond appropriately.
And with that, we are just about out of time. We have a couple minutes left, so maybe we'll just go back to you, Elizabeth, one last time, just for any closing key messages that you'd like to leave the audience with before we wrap up.
Okay, so I think maybe key takeaways are that sexual exploitation of adolescent boys is happening. It's happening in Canada. It happens around the world, but we still know very little about it. And so more research needs to be done. Clinical services need to be thinking about that question, what about the boys? And be giving serious thought to how might sexual exploitation among boys be very similar to or very different from the same experiences among girls or among transgender youth, and how might the interventions that we have created be adapted for boys and young men. Thank you
for that. And Dr. Wekerle, maybe we'll go give one last word from you. Just maybe you can just let us know where people can find more information about the research that's coming out of the team grant in boys and men's health, and just let us know where we can find more information about this kind of subject matter if people are interested in following up more.
Yeah, absolutely. There are two special issues on sexual violence that looks at gender. One is for 2017, one is in Child Abuse and Neglect, and one is in the Journal of Child and Adolescent Trauma. And some of Elizabeth's preliminary work to this systematic review are in those, as well as going to www.in-car.ca, the International Network for Child and Adolescent Resilience. There is a newsletter from the team that's on that homepage, as well as our presentations. The team presentations are on that website in the media. There are a YouTube channel, Resilience in Youth, that has various videos, including one from Elizabeth about this topic of what about the boys and male sexual victimization. And to go also to the CHR Institute for Health, Human Development, Child and Youth Health video talk series to see a 3-minute video that has overviewed these issues and really highlights that while female victims, we quite expect them to go in for mental health problems. The male victims seem to show up, for physical health issues at the level of hospitalizations, although they do seek some mental health. We know that males are far less likely to be help seekers, and that if we as clinicians and care providers, first responders, do not think that males can be sexually exploited or sexually abused, then we're potentially adding to the stigma that victims already feel, and male victims tend to have these multiple stigmas put at them. And I think we can change that as a group.
Well, thank you very much, both of you, for a great presentation. It's certainly a challenging topic, but a very important one. And do go check out the video at the CIHR YouTube channel and vote if you choose. There are lots of great videos there, so for you to vote on, and many of them, all of them, I guess, in the area of child and youth health. So do check out those videos and certainly give some thought to voting for it. So thanks again. We do our webinars every Wednesday at 11 a.m. Eastern Time, and it's always great when you can watch live, as the comments and the discussion really add to the presentation. But when you can't watch live, we do record these sessions and make them available after the fact on the Knowledge Exchange Network at ken.cafc.org. Next week, on November 29th, we're going to be learning about how to say yes to less, and that's where we're going to bring in Dr. Jeremy Friedman, who's going to talk to us about how the Hospital for Sick Children in Toronto used the Choosing Wisely initiative to reduce unnecessary tests and procedures. Many of you may have heard of the Choosing Wisely initiative, or the choosingwisely.com website, which is a great initiative to reduce unnecessary tests and procedures. So we're going to hear how sick kids implemented some of that initiative. Then following that, on December 6th, we'll be welcoming our colleagues from the CHIO-OC-TC Complex Care program, and they want to hear from you about what you have seen that works to support the non-medical needs of parents with a child who has complex needs. What are your lessons learned that you can share with us? What could hospitals and healthcare providers, governments, schools, employers, and others do today that would make an immediate difference for these families? Your ideas will be used to help build a national toolkit for supporting parents of children with medical complexity. So some great stuff coming up in the next couple of weeks, and we hope to see you back next week. Bye, everyone.
Bye. Thank you.
Thanks.
You're welcome.
Bye.